Hello, Temple University. December honors HIV Awareness Month, which is an important time to recognize the historical progress that has been made in testing and treatment for HIV and AIDS, and look to the future with hope for what's to come. The Wellness Resource Center is honoring this month by having students speak with experts to prepare for a conversation explaining what we've learned about HIV. We plan to share insights about the community, education and advocacy, new research, and the importance of testing and treatment to work towards destigmatizing HIV and AIDS. My name is Kate. I'm part of the Wellness Resource Center. I'm a student staff member, and I'm here with Althea, who's another student staff. So we're going to introduce ourselves. We have both spoken with experts in the HIV community, one more of the education side, and then one more of like the medical scientific side. So we have a lot of insights to teach you guys a little bit more about HIV and the progress that's been made around research around it in the last, 50, 60 years. So first, I'll start with myself. As I said, my name's Kate. I'm the student sexual health program assistant at the WRC. I'm an advertising major. I'm a junior. And I spoke with Anastasia, who's a sexologist, currently pursuing a degree in public health, a ED. This is her 5th degree, so she's very well informed about sexual health and HIV in particular. Then Althea.
Hi everybody, I am Althea and Nuevo. I am the Peer Education Program Assistant at the WRC. I am also a second-year nursing student. I talked with Dr. Shawn Frapp. He is an assistant professor at the Temple Nursing School, and he researched and treated multiple patients regarding HIV and other critical care environments. For context, a little bit about HIV. HIV stands for Human Immunodeficiency Virus. And then AIDS is its last progression into a phase where patients are more compromised to different infectious diseases like fungal, bacterial, and viral infections that healthy people can normally fight off. With HIV, it is a retrovirus, meaning that it uses RNA compared to DNA, which is the genetic material of our cells. It converts RNA using a enzyme to convert it into negative DNA, and then it will continue to replicate and hide within our cells, particularly T cells, which is an important immune cell within our bodies that we use to treat infectious diseases. One of the main ways that HIV is spread is through unprotected sexual intercourse with an infected partner. Particularly with HIV, this is a very preventable disease. And I think we can start talking about different methods and different initiatives that we have in place to actually prevent HIV and get care to different people.
Yeah. I think it's definitely worth noting as well with HIV that there are other ways that it can be spread besides sexually transmitted. That's definitely the primary way in which it is, but there's some other ways that can happen. If there's and this is a very, very small percentage of cases start this way, but it can start from, an accidental needle stick or unclean needles, any sort of transmitting of bodily fluids in that way. It's not just limited to people who are having sex or unprotected sex. It can happen in other ways as well. But it is super easy to detect. And now there are ways to prevent yourself from getting it if you are engaging in activities where you might be risk to exposure. And then also a lot of ways to treat it. So that is something that's really uplifting and that we'll get into more, is how treatable HIV is and what HIV treatment looks like. We can both talk about this. We've talked about how HIV can be spread and what it can look like. But a lot of times it will be undetected at first, or just you're not able to see that you have that disease. So it is really important to get sexual health testing and STI testing as frequently as you see necessary. A lot of times I recommend to do it once a month if you're sexually active. And if you are a Temple student looking to get STI testing done, you can get that done at the Student Health Service Center. So that's located on Broad Street, right above the Wendy's, kind of in that building. They're on the 4th floor, or are they on the second?
They're on the fourth floor.
Okay, yeah. So they're on the 4th floor. Our friends over in sexual health. It's super easy to set up an appointment through the TU portal. You don't even need to call anybody. So yeah, they can get you tested for HIV along with a bunch of other STIs. So definitely keep that in mind if you're thinking that you might be a person who may be exposed to it. That's the way that you can go, and they can help you get the treatment that we're going to talk about now. When HIV first really became a problem, which was in the 80s and 90s, that's when that big boom was, where HIV was super affecting. It was running rampant throughout the community. It definitely was really detrimental and awful, specifically affecting the homosexual communities in America, in England, around the world, really. But HIV is not the death sentence it was then. At that point, it was really hard. People would get sick and there wasn't any treatment. So, it led to a lot of people passing away. But now we really have a lot of medications and treatments in place where that is not the case at all. People that get HIV now can live a completely normal life. They can do everything that somebody without HIV would have. You're never completely cured of HIV. You will always have it. But if you take your medication, you're consistent with the treatment, you can live a completely normal life. You can become undetectable, which means that you're unable to transmit the disease to anyone else. You can also, have children, have sex with people who do not have HIV, and keep everyone in your lives safe as well. So, Althea, do you have any information about what the kinds of treatment that are available are right now for people with HIV or AIDS?
Yeah, there's many different treatments, but the main point of treatment, once again to add on, is to reduce the viral load or the amount of virus within the body to an undetectable amount. And then with the type of drugs that are available for patients, I want to first relate back or go backwards a little bit to add on to what Kate said. Yes, there are treatments or there are diagnoses that you can get at Temple campus, but if you're uncertain about having a healthcare professional in that instant to test you, there's also home oral swabs, which is another rapid way to get testing done to see if you do have HIV. It is similar to that of what we did with our COVID tests. So in that sense, it's very accessible. However, we still recommend that you do reach out to healthcare professionals about this illness if you do test positive, or if you think that you did the test incorrectly, because it is possible to get a false positive on the test. And then moving on, there are several different ways to treat HIV, but I do want to highlight PrEP, PEP, and long-term PrEP. So PrEP is a preventative form similar to like birth control, where you will take a pill, a combination of 2 drugs daily to prevent HIV transmission. Another thing with PrEP, you don't have to do the daily method. It is recommended because it does have a higher effective rate, but there's also the 2-1-1 method, where before 2 to 24 hours before sexual activity, you take 2 pills, and then 24 hours later, or on the same day, you take 1 pill, then 24 hours later at the same time, you take another pill. And this is shown to actually heavily reduce the rates of HIV, especially in for patients who do transactional sex, or may undergo a sexual activity with an untested person. And then with PEP, or I did forget to mention, PrEP is pre-exposure prophylaxis, and then PEP is post-exposure prophylaxis. With PrEP, the 2 drugs that are available are
Looks like Apertude, maybe?
Apertude. Apertude is an injection that goes in the muscle every 2 months. And once again, this is a alternative towards the pill method, which is...
I think we're okay without the names of the specific...
It's Truvada and Descovy.
Okay.
It's Truvada and Descovy. Those are the 2 oral daily drugs that you can take. But Apertude and Yestugo are injection and long-term base PrEP, which, like I said, is another method if a patient does not want to take the pill method. And then with PEP, this is an option for patients who were exposed to HIV, either with a patient or a person who has an uncertain STI status. Patients can take 2 medications every day for 28 to 30 days to reduce the incidence of contracting HIV. And once again, this is taken within 72 hours of the sexual activity.
Yeah, so again, like these drugs that, you can take if you are exposed or think you may be exposed, can really create or can get people down to an undetectable level, which again, if you're undetectable, you're unable to transmit. So that means that you're able to continue having sex with your sexual partners. Of course, as we say, you always want to have a conversation with your sexual partner and have open and honest dialogue about any STIs you may have, or what you are doing to keep, as individuals, to keep yourself safe from those STIs. But if you can completely continue having sex with partners who do or do not have HIV themselves. You also can, you won't get sick. You can live a full life, have a job, participate in society in the way that anyone else would. You can even still have children if you're having children yourself. You can have those children and they will not be born HIV positive as well. Something that was super uplifting that I talked about in my conversation with Anastasia was that there used to be camps for children with HIV, children who were born with HIV. And those camps have been shut down in the last couple of years because there's not enough children to attend them, which is, obviously it's like, oh, that's sad that initiative is ending. And then you really think about it. No, it's not. It's awesome. It's awesome that these rates of children being born with this disease are really going down so much that they don't even have enough to continue these initiatives anymore. So that's a really uplifting thing. And overall, in my conversation with Anastasia, it's a very uplifting area where all of this medical and scientific progress has been made so that, the outlook is so much better than it was in the 80s and the 90s. And, in the last 50 years, just so much progress has been made. And now it's really up to us to catch up as a society. So that means destigmatizing HIV, and then, helping to educate people about what it is, which is, the goal of this podcast here. So, learning all you have from Althea and us about what HIV and AIDS is, because there is a lot of misconception about how the disease works, how it's transmitted, all of that. combined with the outlook and the changing outlook for HIV patients, is the baseline to understanding and helping to destigmatize this disease in society. So, I guess starting off with how we can go about destigmatizing this in society and the issues around stigmatization, I'll talk first about some big myths in the HIV community. So there's a lot of stereotypes about who can get HIV. You know, it used to be called the gay disease, but that's not true. It's not limited to just people who are having sex with the same sex. It's not limited to just homosexuals. Anyone can get it. And also, we're in a new world sexually. Gender and sexual identities are not what they were 40 years ago, and it's such a wider range of spectrum for that. So really, it's just something, again, to be having conversations with your partners, and regardless of who you're choosing to have sex with, to be getting tested, especially since testing is so accessible and available now. And there are also many different ways that you can get it. There's stigmas that exist among medical professionals as well. We were talking in our podcast about times that, we've experienced medical professionals who didn't have all the information, or Anastasia was saying there have been times where she's had to correct a medical professional that she was speaking to, which is a little bit scary, but that's again why it's so important to educate yourself before going into a doctor's appointment. And we can talk later about advocating for yourself in a medical setting, because that's super important as well. But yeah, just like in one sentence, we could say that, it's not a death sentence. You can live a long, fulfilling life with HIV, and you can do anything you want as long as you're getting the proper treatment and care for it. I'm trying to think if there's any other major stereotypes that you talked about in your conversation.
Yeah, so one of the most susceptible groups to HIV are men who have sex with men. And these men don't have to be bisexual, gay. Some can even be non-identifying. And with this group in particular, Dr. Frapp and I were talking about how also the communities of color are particularly susceptible to inaccessibility to HIV treatment and just healthcare in general due to distrust, socioeconomic status, and they're also at a higher risk of homelessness and food and housing insecurity. And so these aspects
they all kind of compound onto each other, right? Yeah, so it's like compounding issues in a way. But yeah, again, like they're going back to just the fact that there are ways to address this. So it's just to be mindful and be educated about this. Know that if you don't fall into that demographic, you're not immune. But yeah, another thing that we talked about is that with college students in particular, we see social media as a big way that people receive information about sexual health. And it's really hard with social media because there's so much information coming in. A lot of it is probably not the most accurate, and it's really hard to sort through that. So I asked Anastasia for some tips on how to critically evaluate the content that you're seeing online. And she said to just question everything and to stay curious, which kind of goes about with everything, not just online content, but to definitely question, do some more research if something jumps out at you. And that even if it seems like a reliable source, and maybe especially if it seems like a reliable source, to still question the information that you're taking in and stay curious, try to learn more when you're you think you're learning something new. She called it the additional synapse. So another synapse in the brain, like after you take in information, you should think, wait, question it before you really store it in your brain. And then also we were talking about major myths that people see online, which is that only certain people can get it, as we said before, that sex is the only way to get HIV. And then another one that I want to highlight is that if you have sex with someone who's on treatment, that you will get it, which is not true. If they're at a point where they're undetectable, they are untransmittable, which I've said a couple times, but that's just, another major myth. And that, to address myths people see online, you should really start first with the basics, which is what we did. We talked about what HIV was, how it gets transmitted, and then to, break down these myths that are there. And also in this conversation, we want to make sure that we are holding space for grace and accountability. It's definitely, this misinformation is a widespread problem. So if you have been thinking a certain way or have taken in certain information that's not true, like, that's not a bad thing for you. Like, this is just what the society kind of looks for right now. So, always encouraging as well to ask silly questions. So, and we'll say it at the end of this as well, but if you have any questions about anything we're talking about today, you can definitely reach out to us. And even your silly questions are worth asking. So even if it feels like, ooh, I should probably know this, ask the question anyway, and we would love to answer it for you.
Yeah, I definitely want to add on, like, we are in an age where social media are many ways people's main form of information. And then along with social media, it is also a bridge between different communities and also a new way we're navigating relationships. But in the end, what's really important is communicating understanding one's biases and one's uncertainties.
Mm-hmm.
One of the scariest things you can do to someone who just may have tested positive is to berate them or
reacting in like a negative way. You want to obviously hold space for their feelings about it, but also, speak to them and say, hey, I've learned about HIV before, and I know that this is a disease that can be treated and that there's all this positive outlook. So, it might be scary in the moment, but don't act yourself scared if you're, going through this with a friend or a family member or something like that. I think also it's really important. Another thing that Anastasia said that really stuck out with me is that you shouldn't be shy when talking about HIV and HIV treatment. Like, talk about it confidently and casually. We can just have these conversations, and we should feel comfortable having these conversations as well.
Yes, state your status, especially in the beginning of a relationship, right? Because once you share your status, now there's a foundation of trust between you and your partners or your partner.
Yes, and if you integrate it in a way that is casual, it will become casual. It'll feel more casual. It won't feel like this big, scary topic. It'll feel like, yeah, this is something that we can all talk about together as a society, even beyond your close, relationships. And then also to promote with these conversations, not like a scary or a fear or like anything like that, but to promote just that you are learning and that you can grow from having these conversations. And they can be empowering as well. It is so empowering to be able to advocate for yourself with a partner and have conversations that are, they build upon each other, they're productive. They can help strengthen a relationship as well. So there's just many different pros to having these conversations. It can seem scary at first, but if you go into them confidently, it'll feel less scary.
Yeah, and not only just that, explore everything. Even if you're not HIV positive, search and research for different methods. We have PEP, we have PrEP, and we have other methods of treatment that we're continuously researching and adding on to make it more affordable and accessible to everyone.
Yeah, Anastasia was saying as well that in a lot of the HIV education that they do now, they kind of introduce HIV along with and compare it, I guess, or talk about it along with other like immune diseases or autoimmune diseases because they work very similarly. And that it's just different in that with autoimmune diseases, you're born with them, and with HIV, you can acquire them. Although some people are born with HIV, but most of the time they are acquired. But they work very similarly in terms of the actual like medical, how the illness works. So that's kind of a way that you can introduce it with something that might be more familiar to people, like an autoimmune disease might be more familiar and doesn't have that stigma of being a sexually transmitted and having all of this history of being, in the media being called, the gay disease and stuff like that. It's very different. So that's a good way to recontextualize and ground in what the actual nature of HIV is. So that's a good way that you can go about talking about it as well.
I just want to plug in some resources outside of Temple that people or students can use to actually learn and connect about HIV. There's the Mazzoni Center, Philly Fight, and the Ryan White Foundation. These foundations have trained social workers, behavioral therapists, healthcare professionals in like inclusive treatment and education for HIV.
Yeah, another one, an online, this is like another online resource that's more the education route, but Amaze, which has more than just HIV. It has so much about all different areas of sexual health, but Amaze has some really great information about HIV as well that you can go to. So those are really great resources for learning more about HIV. And they are very reputable, easy to access online as well. And then another thing I wanted to touch on is advocating for yourselves in a medical setting, because that is something that can be very scary. And the number one way to best advocate or set yourself up to advocate in a medical setting, so that might be at an appointment, at a treatment, if you test positive and you need to go about routes to treatment, being able to know what you're kind of going into and have some information ahead of time to help you better make decisions in the moment. So the number one way to do that is to educate yourself and inform yourself ahead of time. So just learning what you've learned from today in this podcast, you've learned a lot about HIV that could help in a medical setting to advocate. Another great way to do that is to practice out loud with someone you trust ahead of it. So, going through, here's what I would ask for treatment. If you look at treatment options ahead of time and you think you have an idea of which one is the best for you. Also, obviously, you want to be open to hearing what the medical professional has to say, if maybe you were misinformed or they have another idea or solution for you. But to go in with a list written down of your goals and the questions that you might have. You don't want to leave an appointment and be like, oh, I wish I'd asked about this, or I'm unclear about this. So writing stuff down can really be helpful for people. And for some people, it's great to bring in somebody that you trust who can act as an aide or an advocate. So if you do have somebody that you feel comfortable joining you for those kinds of appointments, you can prep them ahead of time and be like, hey, here's my goals and here are my questions. If I forget to ask, or if a friend's too scared, like, can you help me? And hopefully you can find someone to do that if that is what you would like, if that is your preferred way to go into a health appointment. And then another thing Anastasia said is that, we live in this capitalist society and healthcare is a service. So you're paying for it and you should get what you're paying for. So you should be paying for a completely comprehensive appointment. And then I guess that's like a good overview of HIV in society, kind of in those intersections, the stigma that exists and how we should fight against it. And then also how to go about it in terms of making sure that you're getting tested. If you test positive, make sure you're getting treatment, and to advocate for yourself in a medical setting. A lot of these resources that me and Althea listed as well can help you go about all of these steps and stages of getting treated, getting tested, anything like that. And then I would also just like to highlight some really positive parts of HIV, the severe right now, which is that infection rates are down really significantly thanks to PrEP and PEP. These drugs are really almost miracle drugs. Like, scientists and medical professionals worked so hard on them to get them available, and they've done exactly what they were supposed to do, almost exceeding the expectations that were had. It really is such a better outlook now. And people who have these diagnoses have so much more support than they did back in the day. It already is such a shifting sphere and shifting attitude towards HIV. And people know now that it's not something to be ashamed of, that it just is, you're sick and this is a way, and it can be treated. So that's a great way as well, a great thing to know as well. And then it's really moving in a hopeful direction. So we just need to get on the same page socially and socioeconomically as we are with, the science that has been so positive and optimistic. And yeah, we really are in a society now that is so much less judgmental and open to diverse experiences. So this is just like another experience that some people have to live with. And as a society, we can be so supportive by just trying to do our best to destigmatize in our everyday lives. In Philadelphia, there's a bunch of great resources. There's the Philly AIDS Thrift, which is a huge thrift store that helps to benefit HIV research and patients and stuff. That's like a really great Philly staple. AIDS Walk Philly used to happen. I think that they just did their final one this year, but that was a really great thing as well. Like this city has always been very in tune with HIV patients and people with AIDS. And yeah, it's just a big success, very medically empowering. And we're hoping that this podcast can definitely help inspire people to go about destigmatizing in their everyday lives and also to inspire people to get tested. So, yeah, I guess very much reiterating what I was saying earlier, but
yeah, as I just want to add on, like, Dr. Frapp said that Gen Z has the opportunity of not living through these struggles in the past. We can actually use inclusive language and find the right scientific terms. However, the fight isn't over. There's still many people who can't pay for PrEP or PEP as it is not covered by insurance. However, that as Gen Z, we have access to so much information, so much communication. And he said that we should be revisiting the past and revisiting what people went through and what they struggled with and how we can continue to evolve as a society to, include all people in the conversation of their health.
Mm-hmm. I think 100%. I think it's important to highlight the diversity and make sure it's visible. And yeah, there are definitely people who still struggle financially with this disease as well. There's so many different foundations in place to help those people. But it's definitely something that we still need to work on. And that's what we're saying. We're like, socially, we need to catch up to this progress and to this optimism. And starting at the individual levels, but then also if you feel inspired, you could make a donation, you could offer to volunteer. There's so many great opportunities to do that in the city. And also you can, always be writing to our political officials to help make some change in how this treatment can be administered to people and the accessibility that comes with that as well. Yeah, so I think that we're going to start to wrap it up here. Again, if you have any questions, you can definitely reach out to us at the Wellness Resource Center. You can visit us. We're on the second floor of the Student Center, right above the food court. If you are going up those stairs, just keep going up and you can't miss us. There's a couple signs. So you can always visit us in person. You can also email us or follow our socials. They are all at BeWellTU. We're on Instagram, TikTok, Facebook, I think everything. So definitely check us out and connect with us on those. We push out a ton of information, and we will be pushing out more this month for HIV Awareness Month as well. So if you're interested in learning more, that's a great area to reach us. And definitely visit us and connect with us, even if you don't have any questions. I'd love to thank Anastasia for joining me. And then
I want to thank Dr. Frapp for also joining me and giving us this opportunity to actually speak on your behalf and try to educate other fellow students.
Yeah, so thank you so much for listening and for joining us for this podcast. And we would like to say, be well to you. Have a great December And thank you for listening.